at present, and that's because of the COVID infection that has pushed us all to online learning rather than in real life. And so we're doing a lot more of social media these days, basically because you're looking at online teaching. And the social media that we are looking at involves Twitter, basically, even though there are other social media here like Facebook, LinkedIn, Google Groups, WhatsApp. WhatsApp is a pretty popular media in India, and TikTok and YouTube and so on. But I'm going to base my talk mainly on Twitter because that's the social media that we tend to use in our discussions as well as passing of links and so on and so forth. We have spilled over to some extent to Facebook as well. The other social media do not lend themselves to adequate discussion, and this is more a sort of links that we provide on Twitter when we look at the other social media that we mentioned here. Part of this talk was actually given at the Kidney Week late last year, and part of those slides I've included here, and therefore you can see the Kidney Week branding on some of the slides. Twitter obviously restricts us, used to restrict us to about 140 characters, which is a pretty small text statement that you can make. But now it's increased to 280, still small, but better for us to write some text with links and so on. Registered users can post tweets, unregistered users can only read them. So I would invite you all to actually join Twitter because there is a humongous amount of discussion in nephrology, links in nephrology, journals in nephrology that give out free articles for us to read at times and so on. And there's so much going on, and that's something that I'm going to tell you about. You can use the Twitter app on your phone. You can use it on a website sort of interface on your laptop or PC. And you can also use special applications that have been brought up by people like applications like TweetDeck and so on. Like I said, nephrologists have taken to Twitter like fish to water. Earlier on, it was more of a sort of a linking with each other, conversing and sharing of thoughts. But now there is structured nephrology teaching, learning in the form of conference tweeting, journal clubs, gamification of education, which is very exciting and something that I'm very fond of. Webinars, quizzes, case-based discussions in the form of tweet chats are now in vogue. And let's look how the focus is shifting, not gradually now, much more faster due to these social media interventions because COVID has caused this push a lot more now than about a year or two ago. It is difficult to obviously convey an idea in just 280 characters, but the ability to attach a link to a journal article, a blog, a picture tweet, a visual abstract, a link to a live streaming video or a recorded video are all avenues for us to further the education. Tutorials are another exciting way and a unique way to impart knowledge, and I'll be speaking about this in the next 40 minutes or so. Just to give you a brief glimpse at the anatomy of a tweet, I reiterate again, I call all of you to join Twitter because this is an area where nephrologists follow nephrologists, don't follow politicians and musicians and so on, because your Twitter line of viewing will then be crammed with other stuff rather than nephrology. On my Twitter app, I only follow nephrologists, internal medicine specialists, cardiologists, and so on. So the anatomy of a tweet, if you look at this tweet, you're looking at the name of this American Society of Nephrology tweet. The @ASN Kidney is the Twitter ID. My Twitter ID is @Arvind Conjeevaram. You can see that at the bottom of the slide on the right-hand corner. This is a picture or icon. Once you register yourself on Twitter, do put your face there, kidney icon, anything, because a blank icon doesn't attract much followers. A picture icon does. This is a hashtag, and I'll come to hashtag Kidney Week here is a hashtag, and I'll come to these hashtags in a bit. A web link, you can provide a web link. So Here, this web link took you to registration for Kidney Week. There are other web links you can provide to blogs and so on and so forth. This is the picture or slide that you can put up. You can put up visual abstract. You can put up text. You can put up stuff like that. Take a picture of your screenshot of your phone. Put that up as a text or a slide picture. That icon suggests that you can reply to this particular tweet. You can retweet it, which basically means that you're putting the tweet back into Twitter for your followers to look at. You can like the tweet. You can share the tweet on other social media. You can copy that link and put it somewhere else on Facebook and so on. You can make a bookmark to it so that you can read it and so on and so forth. So that is the anatomy of a tweet. Now, when you get onto Twitter, and I've told you this, I don't follow politicians, musicians, film actors, and so on, because that's the first thing Twitter wants you to do. It puts up the faces here. Follow this person, follow this politician, follow this actor. So I tend to say no to everything and just follow this group of people initially. You can sort of look at following your own group of people. These, and you can take a screenshot of this if you want to, these folks are very involved in nephrology teaching, nephrology discussions on Twitter. And this is something that I tend to follow. I tend to follow a lot of Indian folk because I'm in India. You have an international set of people that you should follow. You have a set of groups of journals here that are very important for you to follow, because the journals will come out with articles and they will send you links to those articles, which you can easily see on Twitter. Others, Tony Brew, for example, you have Rograd, you have Eric Topol. These are other medicine and other allied specialities that I am quite fond of, because these people do a lot of discussions on their particular subject, be it cancer medicine or general medicine, cardiology, and so on and so forth. So that's something that I do. I do follow folks from Africa, of course, and here is a list of those folks. Elliot Tanner and Gawad Nephro are two names that stand out here because they belong to the ISN education team, of which I was the past chair and now a member. So I know them quite well. And these are the other members that currently I tend to follow on Twitter. What is a hashtag? A hashtag is written with that symbol, what looks like a fracture symbol, and it is used to index keywords or topics on Twitter. So you have plenty of these hashtags. For example, Kidney Week is a hashtag. That NephJC basically means that's a nephrology journal club. ISNCon is the Indian Society of Nephrology conference. ISNWN hash is the International Society of Nephrology's World Congress of Nephrology, and I'll come to that in a moment, because conference tweeting is another thing that we're doing. ECNF is my own child, which is basically everyday cases in nephrology that we do a lot of discussion on. In fact, immediately after this talk, I'm going over to the ECNF discussion that's going to happen starting in about 40 to 45 minutes time from now. Why are hashtags used? Because if you use it before a relevant keyword or a phrase in that tweet, Twitter tends to categorize those tweets and helps show them up more easily in a Twitter search. So if you hashtag a particular word and search for it, you'll get all the tweets that have that hash. You can click on that as well, on the hash, then that hashtag word basically then shows you other tweets that have the same hash. What do you do on Twitter? Well, you can discuss. So here is a sort of a set of tweets that show a discussion. Swapnil, top of the list there, talked about ACE inhibitors being quite useful in a certain clinical situation. And Juan Carlos from another area of the world comes back and says that captopril was initially used for prevention of contrast-induced AKI. I was dumbfounded by that, because we tend to stop ACE inhibitors when we go into these sort of procedures. And then I looked at my own data, and there was actually a paper from India, from the SGPGI Institute in Lucknow, that commented that they've tried out a trial using captopril in such a situation. So basically, you're looking at discussing stuff. It could be mundane stuff. It could be nephrology-based stuff. It could be a question. Asking a question on Twitter, you can use the hashtag AskRenal. And when you do that, for example, this person asks, in dialysis-dependent patients, why do you do dialysis after IV contrast procedures? Bang, you get the answer. You really don't do dialysis after a contrast procedure. Ankit Sakuja says, no, we don't tend to do it at all. Saurabh Sharma says that, well, if the patient is fluid overloaded after a contrast procedure because of load of contrast, you may want to do it. And then Edgar Lerma comes back and says that, why do dialysis in an end-stage renal failure patient? You're not worried about contrast-induced nephropathy, so you're basically beating a dead horse, or don't do it. No sound basis for routinely recommending hemodialysis. So these are sort of responses that you get to a question that you ask. You can ask various questions, questions that you have a problem with in your particular hospital where you've seen a problematic case, and it will be readily answered from nephrologists from all over the world. Tweeting in threads is an exciting form of discussion. Tony Brew, I would say, is the king of tweeting in threads. And here he's tweeted a thread out about why does nephrotic syndrome present with periorbital edema. So he's talked about the underfill theory. He's talked about explanation about oncotic pressure and so on and so forth in a set of tweets. This set of about 16 to 18 tweets, he's sort of brought out the pathophysiology or the physiology of periorbital edema and nephrotic syndrome very well. So this isn't just something that you get to see on Twitter time and again, and it's a learning aspect in nephrology that I'm very fond of. So what are these different modes of learning? You can learn from random tweets. You can banter with other nephrologists. You can query tweets. You can see tutorials or threads. You have tweet chat sessions, and we'll come to that. Webinars, blogs, gamifications, podcasts, visual abstracts, conference coverage, and something I never thought would happen when I joined Twitter, a scientific collaboration across the world where you can actually present posters and papers in various conferences. I just joined Twitter in 2014 just for the heck of looking at what is there on Twitter in nephrology. I was not looking at anything else. And I met a group of varied people from all over the world, to the extent that I met folk from the International Society of Nephrology who were forming a team to get into covering conferences. And lo and behold, I became a member of the team and flew to Mexico to cover the conference there in 2017, the World Congress of Nephrology. People appreciated these conference coverages, and then I was made the lead of the next team that was covering the conference in Melbourne in 2019, the World Congress of Nephrology. So leaps and bounds, basically, and I was astonished at the progress that I was making. Now, nephrology educational resources on Twitter are plenty, and one of the first educational resources that I'm very fond of propagating is the ISN education team. The International Society of Nephrology formed an ISN education group. This is a group of about 35 nephrologists from all over the world. And this group of nephrologists basically is involved in various educational activities on Twitter, and I'm going to show you exactly what that is about. Webinars. Nuances in nephrology webinars is what we started off with, and these are basically webinars that happen once a month. Various topics, as you can see here: point of care ultrasound, focus on the kidney. You can see snake bite and acute kidney injury. This particular webinar came from Italy when in March of 2020, the focus was on Italy because of COVID infections had increased by leaps and bounds there. We in India and other places did not know much about COVID at that time. Francesco Iannuzella, the nephrologist there in Italy, actually, talked to us through the webinar to educate us on what was happening. It was a devastating scene at that time in Italy, and we got to know more about how to manage COVID through him, because that was a first-hand information that we were getting about COVID through Francesco Iannuzella, a nephrologist based in Italy, and he gave us a webinar. And this webinar was attended by about 1,700 folks from all over the world. So much so, it broke the back of the Zoom meeting system, and we had to record the webinar and put it back out again. Women's health and kidney disease was another topic. Approaches to treat hyperkalemia, quite a popular topic there. And in fact, just about 4 or 5 months ago, we had Elliot Tanner speaking on prevention of kidney disease in Africa, the role of kidney health promotion. And Dr. Khalida Bulhan Soki from Kenya actually moderated that session. We just had a couple of days ago a webinar where two folks from Turkey came up and spoke. This was coronary artery revascularization strategy in advanced stage of CKD. So basically, you have speakers from all over the world chipping in to give us their viewpoints on what's happening. It's not necessarily the Western viewpoint. It's a viewpoint from basically the entire world that you're getting to hear by attending these webinars. There are also ISN webinars, and these are the ISN DOPs. This was a particular ISPD webinar, which basically had cases and controversies in peritoneal dialysis. You have the ISN Frontiers meeting that are broadcast as webinars through the International Society of Nephrology. This one, just about a week ago, was on the new insights into clinical management of complement-mediated thrombotic microangiopathies. So people from all over the world really speaking. You have the KDIGO webinars as well, and this was an ISN along with the Philippine Society of Nephrology, a KDIGO webinar where they were looking at the new KDIGO diabetes guidelines, clinical and practical applications. And you may all know that the glomerular diseases guidelines were just launched about a couple of days ago. You can expect a webinar on this. All these webinars are actually recorded and kept on for view for ISN members, and that's something that you can think of. KDIGO Clinical Practice Guidelines on the Management of Blood Pressure and CKD. This is a webinar that is now available at the ISN Academy, and I'll talk to you about the ISN Academy in a bit. Now you have various other conglomeration of nephrologists who have nephrology interests, but are also broadcasting on Twitter. GlomCon or at GlomCon is one of those very interesting and studious conference on glomerular diseases. That's why it's called GlomCon. And you have a set of very experienced people who come up with glomerular disease case presentations. And this is followed by a discussion. GlomCon is also taking up students in nephrology from all over the world and putting them into a sort of a study group to look at glomerular disease conferences. And this is very exciting, a 1 hour sort of conference that happens once a week or once in 2 weeks. And this is something that I do tend to attend. Arcana Life is a kidney pathology series. This comes from the US, from Texas. They do a lot of pathology work and do present their cases online. These links we receive on Twitter and go to attend those cases. The ISN itself has an ISN Rent Pack quick cases, which we provide the link on Twitter. This is a 10-minute case presentation followed by a discussion on the case, and this discussion happens over the course of the next, let us say, 4 to 5 days, and then a week later the pathologist comes back with the answer on what actually happened, and there's a discussion around the pathology of that case. Very interesting, and the links to these cases, videos are provided on Twitter, and the case discussion happens on Twitter, and then it is also taken up into the ISN Academy, which I will talk about in a bit. Podcasts are basically stuff that we look at when you're driving, because this is audio, and this is something that I tend to do. I listen to podcasts when I drive. Bangalore has a bad traffic scene. Takes about 40 minutes for me to get from home to hospital. So during that time, I look at healthcare podcasts. The ISN Global Kidney Care podcast is an interesting sort of podcast. We do this during conferences as well, where we interview people who are presenting at conferences and ask them what they're presenting and discuss their presentation a bit. There are also podcasts from other folks, the Neph JC group, which is very interesting. They have their own podcast called the Freely Filtered podcast, and this is very widely attended. This can be downloaded onto your phone. As I said, I really listen to most of these podcasts when I'm driving. Tweet chat sessions are another group of interesting Twitter discussions that happen live. And I just told you that we're going to have one of those discussions immediately after this meeting. The Nephrology Journal Club is one of the best sources of nephrology learning that you can get on Twitter. This is at NephJC, which is the Twitter ID for this group. #NephJC is the way that you tend to follow these meetings or tweet chats online on Twitter. And what actually happens? So, see, we used to do journal clubs when we were in the medical colleges. After that, as a private nephrologist, I hardly do any journal clubs. Now, this NephJC is a 1-hour tweet chat session on Twitter, and it happens twice a month with 3 editions: USA, Asia, and Europe. So you can choose the timings in Africa to decide which time zone suits you. Follow the hashtag NephJC on Twitter. They actually write out a summary of the article and a visual abstract. The article at most times is provided free of cost for that 1 week where the discussion will happen. The latest popular nephrology journal article is dissected and laid bare. Very interesting that many a time the article is not only available free, but the authors of the article are often present during the chat, and you can actually ask them questions and clear your doubts. This is really one of the best sort of modes of education that I've come across on Twitter. Now, we have our own mode of learning called Everyday Cases in Nephrology. Used to happen at about 10 p.m. Indian Standard Time. Is going to happen in exactly half an hour from now, or about 20 minutes from now, today. And this is basically a case discussion where an interesting case in nephrology is presented online. The labs, the x-rays, the ultrasound, the CT, and so on is shared. Finally, the pathology of the patient is shared so that we can discuss out what the problem was, and so on and so forth. We actually presented this as a poster, and then actually wrote up this paper about a couple of years ago. And during that session, where we looked at about 1.5 years of data, which comprised about 25 sessions of discussion, we had nephrologists from 18 sessions, 18 countries across the world participating in that discussion. And this is the case discussion that is going to happen today in about 25 minutes time. This is a gentleman with nephrotic syndrome and AKI. So really move on to Twitter once I finish this talk and see whether you can attend this case. A very interesting case indeed. How do you do that? This is how you do that. You basically go to your Twitter application on the phone. Make sure you're already on Twitter. If you're not, register in to join Twitter. You can do this on your laptop. You can do it on an application called TweetDeck. You need to put up this hashtag ECNeph on the search bar. And once you search for ECNeph, you will find that the tweets come through which are tagged with this or hashtagged with ECNeph, and you can easily follow the conversation. We tend to introduce ourselves and actually comment on the slides, do our own sort of dissecting of the case and decide what's happening, and so on and so forth. So whenever you write the hashtag ECNeph when you join this, you will actually be within the flow of the conversation. It's also a great way to build your network because you meet so many nephrologists there. You can then follow them, which means that you will get to follow whatever they say, and then you can look at their followers and form a larger part of the nephrology group on Twitter. There are obviously blogs on Twitter. Renal Fellow Network is one blog that is very good, and there are so many latest nephrology issues and controversial issues that are very well dealt with these blogs. Last Month in Nephrology is a blog that was created by two nephrologists from Bombay, Tukaram and V.S. Keskar. These two basically look at the journals in the last month of nephrology, what articles came through, dissect those articles, and have written a blog. The blog is really sometimes very humorous and acerbic and well worth a look into. The AJKD has its own blog, the American Journal of Kidney Diseases. Nephron Power is a blog that is authored by Kenar Javeri. He does a lot of writing on cancer and the kidneys, looking at the newer molecules, newer treatment of cancer with all the monoclonal antibodies coming up on how they cause kidney disease and so on and so forth. Now, one of the more interesting parts of being on Twitter is gamification of nephrology education. And one of the hallmarks of this is Neph Madness. This is a game that comes up in March every year. And basically, this is a sort of a March Madness, which is, I think, a basketball game that is played in the US. And they form sort of brackets there. And here the brackets are involving nephrology topics. And these nephrology topics could be anything from COVID-19 to dialysis with ECMO, to looking at oral versus IV iron, transplant versus CKD care, and wearable kidneys, and so on. So you have a set of topics that the professional nephrologists who are managing this particular game, Swapnil Hiremat based in Canada, Joel Toff based in, and Matthew Sparks based in US, they manage this game. And basically they have a set of judges who choose these topics and to move forward along these lines to a, let us say, a quarterfinal, semi-final, and a final match off, and then the champion is chosen. And if you have chosen what the judges have chosen, then you get to win this match. So it's very interesting indeed. The ISN education quiz is something that the ISN education team has brought forward. And this ISN education team with Divya Bajpai, Didem Turgut, Namrata, and Gawad, these nephrology professionals put up quizzes based on tweets, based on the particular webinar, that is Nuances in Nephrology webinar that is going to happen, and a whole load of information is gathered there. Those who score 10 out of 10 in the quizzes get a certificate and get a mention on Twitter as well. Now, Dr. Gawad and Dr. Kita in Africa have come up with a quiz, and they've set up a sort of a monthly quiz that I'm sure you folks have seen already. And so nephrology learning gamification in the form of a game, a quiz, some sort of the Neph Madness that I just showed you, is all very interesting because it sort of spikes your mind in different ways. The ISN Act clinical trials focus is another area where the International Society of Nephrology puts out trials that it's looked at in the previous month. And this comes out in the form of a blog or a text that we provide links to on Twitter. And you can actually go into these, the blogs or articles where you can look at all these recent trials that have happened in the past month. And they are dissected out by a team at the International Society of Nephrology. The ISN education group also has a tutorial team. And these tutorials are based on the webinars that are going to happen. And in fact, just about last week, the ISN education team tweeted out a tutorial on CKD and ischemic heart disease. So you can look at that, usually looking at what happens in the webinar and tweeting out interesting material. So if you look at this, this is just a screen grab of that tutorial. There are about 17 tweets. The 10th tweet talks about dialysis in sub-Saharan Africa. The 11th tweet talks about nephrologists in Africa, and so on. So you're getting such a load of information in every tweet, and links are provided so that you can actually go and view that particular information that you want to look at in that field. Now, the ISN Academy is actually a storehouse of all this information in a particular area. It is open for ISN members. It is open for everybody else, especially those who want to look at COVID data. COVID is free to view, but again, you need to log in with your email and an ID and password. But the COVID material inside this ISN Academy is totally free. Other material is paid for. If you're an ISN member, you can view. There are webinars, there are journal articles, there are other topics, events from lectures from previous conferences, and so on and so forth. All the webinars that have happened in the past 3 to 4 years, even more, are stored inside and can be viewed as a recording. So there are a wealth of data here for nephrologists to look at and learn. NephSim is another group based in the US that puts out simulated nephrology cases, very interesting cases, and something that you could look at. The Skeleton Key group is a group of nephrologists that looks at electrolyte and acid-base challenges in patients, and they put out simulated cases which looks at all these. Conference tweeting is something that we have done a lot of, and I've been to all these conferences and done conference tweeting. The first conference I went to was the ISN World Congress of Nephrology in 2017 at Mexico, and I've been to all these other conferences, tweeted out material from the conferences, and I'm going to show you exactly what we mean by that. For example, at the World Congress of Nephrology in 2019, we put out 17,000 tweets. So those of you who can't attend conferences, if you actually come on to Twitter on the day of these conferences, you will actually get a wealth of information from the conferences, because most of the slides that the speakers are presenting will actually be photographed and put on Twitter. You can go back and view these slides from 2019. They're actually still there. We put out 17,000 tweets with 1,943 members actually interacting with us. There were 8 videos of interviews with speakers. There were a lot more. 62 of the sessions were covered. Posters, presenters were interviewed. There were 25 poster interviews that are on Twitter. Poster talks where we actually combined the poster with the audio of the poster presenter and put that out on Twitter. Visual abstracts, we created 30 visual abstracts last year in 2019 and put that out as well. Daily quizzes. Whatever is presented in the conference is made into a quiz, and gamification education is what I was talking about. Moving to WCA in 2021, this was actually a virtual conference, supposed to happen in Canada, but was virtual. We actually, as part of the social media team from the International Society of Nephrology, covered this as well. We had about 13,000 tweets, 27 million impressions, 857 users. We did 19 pre-Congress interviews where we tracked down the speakers of interesting subjects, interviewed them before the conference happened. We tweeted out 73 live sessions, live tweeting. As the session was happening, we were tweeting out the slides. We looked at 29 visual abstracts to be tweeted out. Again, quizzes were tweeted out. So much material from the conference is tweeted out that, you really, if you're not attending a conference, you can actually come up on Twitter on the days of the conference and get such a wealth of information from these conferences. The virtual conferences that happened last year, Kidney Week, as well as ERA EDTA, they were all tweeted. If you can look at this, you're looking at ERA EDTA 20, there were 5,222 tweets from that conference. And if you're looking at Kidney Week 2019, 21,000 tweets. If you're looking at 2018, 14,000 tweets. So you can just imagine the wealth of information of the conferences that were, that happened there. And we looked at this data through NORDA Analytics. Dr. Tejas Desai provided me with this. We looked at this data, nephrology conferences on Twitter. In 2011, you had basically the North American group actually tweeting it out and a bit from England. By 2018, we had more participants from all over the world. By 2019, most of the world, including parts of Africa, were involved in tweeting about the conference or interacting with those who were at the conference. 2020 suffered a bit basically because at this point in time you had COVID. Many people were sort of fighting COVID and not very involved in conferences. What does the WC and social media team do? This is what it does. Okay, I think we're clear now.
Yeah.
Right. So the World Congress is covered by the WCN social media team. Now, WCN 22 is going to happen in Kuala Lumpur, February 24 to 27. We hope it's going to be an in real life conference that we can actually go there and attend. We're not sure because COVID, we're going to have to look at what happens to COVID at that time. There is definitely a virtual conference also being planned. If that happens, you're going to see live tweeting of scientific sessions. You're going to look at visual abstracts. You're going to look at live visual abstracts, which will happen as the speaker speaks about that subject. You're going to have poster talks, daily quizzes, interviews, podcasts, and daily video summaries. So this is a whole set of stuff that is going to come out from the conference to you folks. If you're on Twitter on those particular days, you can actually look at the conference sitting on Twitter, sitting at home and looking at Twitter and going through the slides and so on and so forth. There are journals on Twitter, obviously. KI Reports is on Twitter. Kidney International is on Twitter. So are the rest of Jason, CKJ, Nephrology Journal, Nephrology itself, CKJ Social, and so on. So they put out tweets which give links to their articles, the latest articles that come up in their on their website as well as in their journals. So this is something that I look at every day so that you enrich yourself with whatever data there is out there on the Twitter world. Now, we have also gone into Facebook. The ISN Education social media team has put up a Facebook page called ISN Education. You can become a member of this. All you need to do is go to Facebook and type in ISN Education. You will be led to this group. You can ask to be invited. You can ask to be a member, and moderators such as me and others will let you in. Not much discussion happens here, but links are provided to various ongoing social media efforts, so you can actually see stuff about conferences and quizzes and webinars and so on within this group. This is a patient group that's also on Facebook, and they have done a lot of work in discussion among patients on Facebook. What are visual abstracts? Visual abstracts basically give you information about a journal article in visual form. This is a visual abstract from KI Reports that gives you this article on self-reported physical activity and survival in adults treated with the hemodialysis. So basically, a lot of nephrology journals have now opted for visual abstracts as a quick way of looking at whatever is in the text and putting it out in a visual abstract form. For that matter, every other journal now has visual abstracts. This is a visual abstract from the New England Journal of Medicine that looked at the typhoid conjugate vaccine in Malawian children. Such a wealth of information in just one picture that you can sort of take it into your brain and mull it over rather than look at the text. You obviously should look at the text if you're interested, but the picture speaks 1,000 words here. Well, how did joining Twitter help me? Well, this is my first article that I ever wrote in Kidney International. I never expected to be in Kidney International as an author, quite frankly, but joining Twitter helped me do that. Presenting papers in various articles about social media, about best practices in social media, about coverage of conferences on social media, and so on and so forth. Not only social media, but I have now been able to interact with other nephrologists within India, outside India, all over the world, and form groups looking at clinical studies in hemodialysis patients, looking at glomerular diseases studies and stuff like that, looking at surveys in dialysis patients who were affected by COVID, and all this have already been published. So I am now part of a much larger group of nephrologists from all over the world, where we collaborate with each other just because we got to know about each other on Twitter. And that's really helped me a lot in writing papers, posters, going to conferences, and so on and so forth. So I'm going to conclude by saying nephrology on Twitter has had a global impact. Twitter has democratized nephrology education. So basically, anybody anywhere can look up Twitter and educate themselves. It's a terrific learning experience in nephrology. You can clarify doubts, you can do case studies, you can get to know cutting edge research, hot off the press, discuss and critically appraise it on journal clubs, and better still, hear from authors themselves who are there in those journal clubs. Various conferences worldwide are at your fingertips as you sit at home, and it adds to the list of your scientific publications and collaborations. I'm going to stop there. Thanks, Dr. Lloyd Vincent. It's back to you.
Thank you very much, Arvind. It is a phenomenal wealth of Twitter that you actually tweeted out today. Wonderful session. Extremely grateful, and we can clearly see the amount of the vast experience you have on social media, and you only talked of Twitter today, and there is so much more. Thank you very much. So let me just open the floor with one question. Now, if we have a new person coming into Twitter, what would be your advice, Arvind, as to how he would go about, acquainting himself, and what should he first do, and what would be 1 or 2 or 3 sites that he should start with, and then get used to, Twitter, and then he can sort of course, expand on it. So, what would be your advice?
Absolutely. So, basically, when you join Twitter, all you do is download an app onto your phone that has the blue bird on it, Twitter. And once you download, you'll be asked to register. You can put in your name with a few numerals, for example, so that you can register on Twitter, put in a password. The Twitter app will take you through a series of registrations. It will ask you, and I've told you this before, it'll ask you whether you want to follow politicians, actors, and so on and so forth. My suggestion is to ignore all of it and go on to look at nephrologists. I have actually provided a set of nephrologists with an at so-and-so names that you can look at. In fact, what I will now do is take a screenshot of that and pass it on to Lloyd Vincent. And those of you who actually want to look at that particular set of nephrologists, you should. And follow 2 or 3 nephrologists who are tweeting all the time. I tweet all the time. There are many nephrologists from the US, from India, from the UK, from other European countries, some from Africa, who tweet a lot. And if you follow these nephrologists, you can look at the list of their followers or the nephrologists that they are following, and you can build this group. You can also attend one of these sessions. NephJC is an excellent session. That is the Nephrology Journal Club, happens twice a month. You can attend ECNeph, a case discussion that is going to start in about 4 minutes from now on Twitter. And these groups of discussions, and I've told you, if you put a hashtag #ECNeph or #NephJC, you will then get to meet lots of nephrologists who will be on Twitter at that time. All you need to do is follow them, and you will then become part of a much larger group, and your timeline will have tweets from all these nephrologists, and you can enter into discussions, ask questions, follow links to various articles, and so on and so forth. So get on to Twitter, try to follow nephrologists first. That's my advice, and things will happen. It will just happen. Don't you worry about it.
Thank you so much, Arvind. The floor is open. Anybody wants to ask any questions, please go ahead. Anybody want to ask any questions, please go ahead. Yes, Dr. Francis, please go ahead. Thank you so much. So let me introduce, Arvind, let me introduce Dr. Francis. Dr. Francis is one of the leading pediatric nephrologists in Tanzania, and of course, trained in South Africa, and a leader in the area here. So over to Dr. Francis, please go ahead.
Thank you, Dr. Lloyd. Thank you so much. I really enjoyed the talk, and I guess I use Twitter, and I'm one of those people that tweets a lot. I do not tweet. I follow the prominent nephrologists on Twitter, and I also had an opportunity to tweet about WCN 2019. Of course, with Basu. Basu is a close friend, actually. So basically, I think it is. I really enjoyed the talk, and I completely agree with you that this is a very useful tool to as a means of discussions and sharing knowledge. And I understand that we you can now have audio discussion on Twitter through Twitter Spaces, and of course there's a new audio app, Clubhouse, which is coming in, and I believe that in the short while people will be making use of that to discuss various cases. There have been a lot of discussions about COVID and other things on Clubhouse, not so much in nephrology, but I believe soon we'll be able to interact through Clubhouse. So thank you very much for this talk. I really enjoyed listening to it.
Thank you. I agree with you. I've used a bit of Twitter Spaces and Clubhouse myself. Not too much of it, but I agree with you. Also, there are a lot of pediatric nephrologists on Twitter who tweet from various countries, and I follow them just for the sake of keeping in touch with pediatric nephrology. IPNA, the organization for pediatricians, pediatric nephrologists, also puts out webinars on Twitter and quizzes on Twitter, and that's just something I follow as well. So lots of stuff for pediatric nephrologists as well as on Twitter. I agree.
Thank you so much. So Dr. Francis, this is a Clubhouse is an app. Twitter Space is it an app? How do you get into this?
Twitter Space is it's a new addition to the Twitter, so you can use Twitter. It's an audio component that has been added on the Twitter. Okay. So instead of messaging, you could use audio, so you could talk, okay. And it's a voice addition to the Twitter. Thank you.
So basically, you get into a room where you use audio only, and you can invite people into that room who can then turn on their audio and discuss with the host of that particular room. So it's quite interesting.
Very good.
Dr. Lloyd, may I ask one question?
Yes, please go ahead, Dr. Amar. Please go ahead.
Thank you for the beautiful presentation. I really enjoyed it. The question I would ask would probably, how would one reach out through Twitter or any other social media or any other application to, to the layperson who would not know about these particular, tags or pages and, just spread kidney awareness? How would we reach out to these other people? Thanks. The layperson.
That's a very interesting question. Thank you. So basically what some of us have done on Twitter on World Kidney Day, we put out sort of a set of tweets that contained myths about kidney disease. What we tended to do is, and if you are on Twitter for some time, you will find that the lay public, especially dialysis patients, transplant patients, relatives of patients tend to start following you. And some of these you basically know. The Kidney Warriors is a group of patients who are on Twitter as well, not just Facebook, they're on Twitter. So we involve those folks and ask them to propagate these tweets that we put out so that the lay public are involved in this sort of a tweet broadcast. And we did that on 2 occasions during World Kidney Day, where we were looking at a particular myth, and then we did a tutorial on a particular myth saying that this is just a myth and so on and so forth. So it's quite possible if you're on Twitter long enough, lay people will follow you, dialysis patients or their relatives will follow you, and you can reach out to them and reach out to many more folks through them to broadcast the information on what really is kidney disease and educate lay people or the lay public on kidney disease.
Thank you so much, Doc.
Thank you. Thank you so much. Any more questions? Most welcome. Any more questions? Thank you so much, Arvind. It was a wonderful session. A lot of revelation and all your, all your journeys through Twitter. I think it's a lot of learning. And if you can share your slides, I will put it across the whole of our audiences. If you can share the important slides, it would be great. And just by email.
I will do that. Yeah,
PDF
I will do that.
Thank you so much. Thank you.
Thank you and bye-bye.